Did you know that before a fracture occurs, your body sends at least 5 clear warning signals about bone density loss? Welcome to Senior Life, Joy and Wellness. Today, we open up a vital topic: the 5 early signs of bone weakening after age 60 that you absolutely cannot ignore. Don't mistake them for common aches and pains. These are the first whispers of osteoporosis, and early detection will help you prevent fatal falls. We are committed to bringing you the most useful and engaging content for your golden years. Your support with a like, a share, and a subscription is the biggest motivation for us to continue building videos that can change your quality of life. This is the story of Mr. Edward, 58, living in a quiet suburb of Texas, USA. Edward always thought he was healthy, but in recent years he started noticing small, persistent changes that became uncomfortable. Edward was stuck in the common mindset of many older adults. He dismissed these changes as an inevitable result of getting old. He ignored the most crucial warnings his own body was sending. Osteoporosis is a silent enemy. It quietly erodes bone density and causes no pain until it is too late. But fortunately, our body never stops signaling. We will analyze the 5 whispers that Edward ignored, one by one, bringing him closer to the risk of a hip fracture. 5 prophetic signs of weakening bones. The first whisper: sudden height loss. This is the most serious sign, often overlooked or attributed to poor posture. Edward noticed his clothes were longer, and he was shorter than his wife when standing together. The scientific mechanism: height loss of over 3 centimeters, about 1.2 inches, is a clear sign of vertebral compression. This occurs when the vertebrae are weakened by severe osteoporosis and begin to collapse. This is not normal aging but mechanical destruction. Height loss indicates that osteoporosis is in an advanced stage and requires urgent medical intervention to prevent hip fractures. The second whisper: chronic back pain. Edward frequently experienced lower back pain, especially after sitting for a long time or lifting light objects. He took OTC painkillers believing it was due to muscle strain. The scientific mechanism: back pain in osteoporotic individuals is often due to microfractures forming in the vertebrae. As the bones weaken, even gentle activities like coughing, sneezing, or bending over can cause tiny cracks. Chronic pain is clear evidence that your spine is overloaded and needs protection through core strengthening exercises and calcium vitamin D supplementation. The third whisper: difficulty opening jars, decreased grip strength. Edward started asking his wife to open jam jars and failed to realize this was a critical functional decline. The scientific mechanism: grip strength is a direct predictor of overall bone density. Studies have shown a strong correlation. When hand bones lose density, the muscles and tendons also weaken. The decline in grip strength is not just a muscle issue. It is a signal from the skeletal system that support is being lost. Loss of grip strength is one of the most important predictors of fall risk and loss of independence later in life. The fourth whisper: loose teeth for no reason. Edward noticed one of his teeth was loose, and the dentist found no clear signs of gum disease or cavities. The scientific mechanism: the jawbone is one of the first areas of the body to lose bone density when systemic osteoporosis sets in. A weakened jawbone cannot securely anchor the teeth, leading to loosening or loss. This is an early warning from the jaw that the entire skeletal system, like the hips and spine, is likely in a similar dangerous state. The fifth whisper: sudden loss of balance when standing. Edward began feeling unsteady when standing or moving. He had to rely on walls and furniture more often. The scientific mechanism: osteoporosis weakens major weight-bearing joints, like the hips and spine. This weakness causes instability in the pelvis and spine, shifting the body's center of gravity. This sudden loss of balance is not merely a muscle issue. It is a signal from the skeletal system that the body's alignment capacity is severely compromised, greatly increasing the risk of falls, the leading cause of hip fractures. The prevention and recovery strategy. After receiving his diagnosis and the scientific explanation, Edward completely changed his lifestyle with the help of Dr. Helen, a geriatric specialist. 1. Rebuilding the nutritional foundation. The calcium D protocol. Edward didn't just take calcium. He was prescribed high-dosed vitamin D3 and vitamin K2 to ensure calcium is deposited into the bones instead of accumulating in the arteries. He increased his intake of calcium-rich foods like Greek yogurt, kale, and dark green vegetables. 2. Low-impact weight-bearing exercise. Edward had to discard ineffective exercises. He switched to exercises that applied gentle pressure to the bones to stimulate bone-building cells, osteoblasts. Single leg stands to strengthen balance and chair squats. Sit-to stands with resistance band support. According to the International Osteoporosis Foundation, strength and balance training can reduce the risk of falls and fractures by up to 40%. 3. Comprehensive assessment. The DEXA scan. Edward was required to undergo a DEXA scan to accurately measure his bone mineral density, allowing the doctor to tailor the correct treatment, which might include bisphosphonate medication. 4. Proactive action. Edward focused on sitting up straight to reduce vertebral compression and installed grab bars in his bathroom. Edward regained his confidence. He learned that bones are not static. They are living tissue that constantly rebuilds itself. Early detection and decisive action are the only ways to reclaim strength and independence. Are you experiencing chronic back pain? Share your experience below. If the video is helpful, please hit like to spread the message. And subscribe to the channel so we can continue this journey together.